George Kilpatrick Inspiration for the Nation, celebrating people we feel good about. So glad to have you as part of our conversation today. Well, it is Men's Health Month, the month of June, and here to help us navigate Men's Health Month is Noel Castro. He is a physician's assistant at Syracuse Community Health. Noel, so good to see you, and thank you for being a part of our conversation. Before we get going, though, let's talk a little bit about you. You are new to the Syracuse Community Health family. Tell us a little bit about your background.
Yeah, so my background, I was trained as a physician assistant at Temple University in Philadelphia, Pennsylvania. My training was about 2 years long, but I've lived in Pennsylvania since I was about, I would say, just getting into my teenage years. We moved, my family and I moved to Pennsylvania in 2007, and I have been living there most of my life. But prior to that, I was actually from the Bronx in New York. So I do have some roots here as well. So it's really nice to be back in the state of New York, and I really do enjoy the opportunity that I've been afforded here.
So you from the boogie down.
Yeah, yes.
That's awesome. All right, so now I got to probe a little bit deeper. What part of the Bronx did you grow up?
From my parents, they told me Kingsbridge.
Literally. Now, do you want to know that that's where for about 40 years?
I'm sorry, could you say that again? I didn't catch that.
Did you realize I lived in the Kingsbridge Road section near the VA hospital for about 40 years. My mom did.
Really? Oh
Yeah.
my gosh. And what are the odds of that?
Right. You said Kingsbridge. I was like, wait a minute. I know Kingsbridge Road, yes, and all of that stuff. So yeah, we were neighbors and didn't even know that. How about that?
Yeah,
Probably
exactly.
neighbors of your parents. You never know.
Parents.
So, what are some of the major health concerns for men, especially in communities of color?
So a lot there can be a wide there are a wide variety of significant health concerns, especially with men of color who are often disproportionately affected. And this is usually due from a combination of socioeconomics, environmental factors, and access to healthcare. Some of the leading health concerns that I deal with on a day-to-day basis are cardiovascular disease, diabetes, mental health, HIV, AIDS, sexually transmitted infections, and cancers.
Mm. And so, and are you seeing that those diseases are more prevalent in these communities, as you suggest? And why are we seeing that more prevalent?
So I'll use the example of cardiovascular disease. And while cardiovascular disease is one of the leading causes of death in men for all racial backgrounds, African Americans and Latino communities have particularly higher rates of these issues. And the factors that really allow this to kind of manifest are diet, stress, smoking, lack of exercise, and the biggest thing is limited access to preventative care measures to help
Mm-hmm.
educate them on what they can do in their day-to-day lives to prevent cardiovascular disease from becoming an issue later in life.
And this is why the community health center is there for that very reason, right? To make sure that
Exactly.
those barriers to access are lifted.
Correct. Absolutely.
And so is that the main reason why these particular underrepresented communities don't seek regular medical care?
I think the biggest problem that I see is primarily access.
Mm-hmm.
Whether or not, they have the time or the resources to get to even the community health center seems to be a really big barrier for our patient population. A lot of our patients don't have transportation. A lot of our patients actually walk to the clinic, and some live very close by and still find it to be a struggle to come to their appointments, to come for their preventative visits because they lack the resources that would normally allow anyone to get to their appointments to actually come to their appointments.
Yeah, and I don't know if anyone told you, but we do have winter here. So
Yes. Yes. Yes, absolutely. So I was told that we didn't get a lot of snow over the past few years, but obviously this most recent winter we did get much more snow than I was even anticipating. But I enjoyed seeing some snow on the ground for
how
once.
about that? So what barring access and making sure that we make it people get people to the the clinic, what are routine checkups and screenings that men should be getting and at what ages?
Yeah, so for men in particular, the immediate one that jumps to mind is colorectal cancer screenings. Usually, the recommendation is usually starting at age 50, but I believe that has now recently changed to even as early as 45. Cholesterol, we usually recommend checking cholesterol for men. There's, I believe, one age, I believe at age 10 or 11. And then as you get older into your early 20s, we want to recheck you again for your cholesterol screenings. And then we also start to always consider screenings for high blood pressure, especially as you start to get transition into 18, 20s, especially 30s when we tend to see it start to manifest. And then additional cancer screenings for men, prostate cancer screenings, usually depending on age, usually the age of 65, or risk factors that would likely increase your risk of developing breast cancer, such as an immediate family member, like someone's father or grandfather having prostate cancer.
No, I was often under the impression that things like prostate cancer tend to be more aggressive in African American men when because it's not detected early enough. That's certainly, am I correct there? And if so, how do we get men of that particular demographic to get the screenings that they need?
Yeah, so absolutely, we can see that there can be some more aggressive forms of prostate cancer that do affect African American men. And by the time that it is caught, it usually is in these later stages. And one of the ways that I feel that we can get these men to come in and to get checked or to, promote them getting checked if they do come to our office is to have a genuine discussion about their individual risks. What do we see in their day-to-day life, whether that's their diet, their stress levels, their family history, that can all contribute, but then also trying to break down a lot of the cultural aspect of that, this kind of men should be tough and very stoic and should avoid seeking help, or having the fear of being vulnerable with another individual to talk about things that they may not understand or that they're not comfortable. Or for the men that may have this fix, if it's not broken, you don't need to fix it kind of mindset where preventative care can be often undervalued or ignored, and recognizing that these things can happen to any individual, especially if, like, for a lot of the patients that tell me it's not in my family history. And I often counter that point by saying there's always an individual who has to be the first person to introduce it into the family history before it is there. So just because it is not in your family history does not mean that you are not susceptible for this to happen to you.
Now, you're also bilingual of Spanish heritage. And so, what about in the Latino community, Latino men especially as well, around preventative care and seeking medical help? Are you seeing the same sorts of trends, or are you seeing it differently? And then language potentially as a barrier as well. And you're bilingual, so that's one barrier that is that can be addressed.
Yes. And yes, the Latino community is also just as affected by this as well. Another issue that I want to bring up that I see men tend to give as an excuse is a lot of the times these men are providing for their families.
Mm-hmm.
They're working hard, they're working long hours, they're tired at the end of the day. They don't want to come to the doctor's appointment after the fact. And I think that is an additional barrier for them, in addition to the language barrier for Hispanic communities in particular, is they don't want to go feeling like they're not going to be understood, that they're not going to be heard out, or that they will have an issue with navigating the health system from getting to the check-in desk where they need to be all the way back to the provider and then voicing their concerns. is a
Mhm.
particular issue that I do think face is in this Latino community can be a big issue is the language barrier.
So let's talk about again prevention and men's health. Again, focusing on men's health because we need to, right?
Right.
And we're not. Uh, I know I'm probably a different example because I go to the doctor. I'm going, and I learned that, and I feel like that is why even in my later years, I'm healthy. I mean, I take a few things. I do take hypertension medicine because African American men are more likely to have hypertension than most groups, and so uh, I'm in that category, right? And so, but I do exercise. I try to get some exercise in. I do walk. Do the one thing I don't do a lot that I struggle with is drinking water, and I know that's
Yeah.
important, but I don't do that. So, what are the healthy habits that make the biggest difference in long term health?
So the biggest thing that I tend to focus on, especially that we can honestly see more change, and especially for something like high blood pressure, is if an individual is overweight, losing 5 to 10% of their body weight, we can see drastic changes in their blood pressure more than what we could normally see with blood pressure medications.
Mm-hmm.
Eating a healthy diet, a varied diet with different kinds of fruits, vegetables, lean proteins, especially trying to minimize the amount of fatty and greasy foods that we're taking into our everyday lives, and then exercise. Of course, exercise will keep you feeling healthier longer. A lot of the times when individuals do exercise, they feel this you feel really good after having a really good workout, whether you do a walk or a run or you go to the gym, whatever that people tend to gravitate toward. Exercise is always going to be beneficial for you, especially for cardiovascular health, for blood pressure, for mental health especially. I think exercise plays such a big role, and in our current day and age, with the way that the systems are set up, particularly our working schedules, it doesn't make it very conductive or conducive for an individual to work, for example, from 8 to 4, from 9 to 5, and then want to go to the gym immediately after.
Yeah, I think one of the tips that I have is the best workouts I find, Noel, are the workouts, talking to Noel Castro, physician's assistant at Syracuse Community Health, are the ones I don't feel like doing, right? I mean, can you agree with me? Like,
I agree with you. Yes,
right,
the best workouts are the ones that you never want to start. But when
right.
you finish them, there's a certain feeling that you get of accomplishment and a little bit of, euphoria almost, like I did that. I didn't want to do it, but I pushed through and I decided to do it anyway, and I felt good about doing it.
And I think, and these are also things that I've heard. So you talked about movement and exercise. You don't have to do it all at once, right?
Correct. Correct. I usually recommend, for individuals who don't tend to exercise a lot, start off small. Do small but frequent exercises, even if it's 10 to 15 minutes, with lightweight. It's better than doing nothing. And then as you kind of progress and you kind of tell yourself, if you're doing weights, for example, oh, these weights are a little bit light, you can go up in intensity. But then also decrease the frequency at which you're doing that, because now you're doing heavier sets and things like that. For walking, if you're just doing a walk around the block, try and venture out and do 2 blocks, 3 blocks, little by little. But building small habits consistently will lead to more consistent and better outcomes long term.
So let me offer this to someone, right? Let's say if the recommendation is 30 minutes a day, let's just say that, right? 3 10-minute walks is the equivalent of 30 minutes a
30
day,
minutes.
right?
Exactly.
So
Exactly.
we have to rethink because oftentimes, I've learned this. This is not something I knew overnight. I have learned just what you said. If all I got is 15 minutes, then that's all I got. But I'm gonna do something in that 15 minutes better than nothing.
Exactly.
The other thing is the holidays are here, right? Juneteenth this week, 4th of
Yes.
July coming up. There's lots of summertime cookouts and barbecues, right? And so grilling, if you're grilling, that's a good healthy way to do some things. But we tend to get into the fatty and the greasy during these times. So uh, we've got to be more moderate, is what I'm hearing you say.
Absolutely. Everything is good in moderation, from cooking style to, what we eat, especially at these barbecues. I think it's good to be aware of what options are in front of you and always try and take things, that are a little bit healthier, but also still have some of those things that you normally would like to have. Just try and have a little bit less of them. Fill up on more proteins and try and avoid things that like for example, macaroni salad, which have like a lot of like mayonnaise, which is very fatty, can be very bad for cholesterol levels. Not to say that you can't have it, but have a little bit less than you would normally have.
Yeah, that potato salad, it's so funny because I saw recently a potato salad recipe that I would not. It wasn't what I'm used to, but it was not what I was used to. But there are different ways you can make things healthy. What I'm gonna say is, don't mess with my potato salad. Maybe I'll have a dab instead of two dabs. How about
Exactly.
that?
Yes, exactly. And it's all about compromising. And exactly what you're doing is the exact way that I would want to think about it. I would normally have two, but I'm just going to have one. That is exactly what I would like to hear from patients. Exactly.
What role does the family and the community play in helping to help men stay healthy?
Yeah. So the family, you said the what role does the family play? I think
Family and community.
family and community. So family and community play a big role in setting kind of what's the cultural norms, and I think that we need to work on that so that these men in particular have a sense of comfort and support from not only their family but also the community, so that they can kind of in their own time come to the realization that they are in a community that is supportive of them and that they don't have to fear being vulnerable, or they shouldn't feel that they have to be discouraged from expressing emotion or wanting to seek help and talk to other individuals, other men about, what they're kind of going through. Because I think once you kind of break down that barrier of, telling these men that it is okay to seek help, it is okay to express these emotions with individuals that they feel comfortable with and that they feel trusted, then those community members and family members can then promote them. Well, why don't you speak to your physician? Why don't you speak to a primary care doctor about this? And to kind of help them get through the door so that they can come to us and see if they need any interventions. Or do they just need some reassurance? Do they need just some time to speak with another individual in the health system about what they're going through and how can they help them get through what they're going through in their day-to-day
So
lives?
important, Noel, that you talk about having those connections. And I know I'm fortunate that I do have a group of guys that I can say, this is what's going on. And we have to normalize talking about what's not right or what's not good, not only from a physical health, but from a mental health perspective, because we've, and culturally, for many of us, ethnic cult, not just ethnically, but in masculinity, if you will, it it it's you don't talk about your feelings, you don't talk about what's going on, and so if the more we can normalize, yo, bro, in a trusted circle, obviously, hey, this is what's going on. I'm doing this, I'm doing that. I found it for me, it's been liberating in my own life, and I'm hoping that other men who even may be listening to this or watching this will find a way to be in that trusted circle. I just joined a group of guys who actually meet to talk about some of these issues, as well as in my fraternal circle. So these are important ways for us to break the norm so that we could be as healthy as we can.
Absolutely. I think having a trusted circle is probably one of the most important things for men to open up. If they don't feel, that they can be vulnerable, particularly, especially with their male friends, then they're going to have a harder time opening up to a stranger or a provider like myself.
Hmm.
I think the first step is to at least admit that you have something going on, and that needs to be vocalized, whether that's through someone that you trust, whether that's a spouse or, other men who may be going through the same situation as you. Because, from a young age, we're really taught or stressed, that we shouldn't show this emotion, to kind of show your feelings, and these emotions are not good, and we are taught, that it's shameful to do that, and you should just suppress those things when it's really not good, for mental health in particular.
And
Mental health, impacts so many other aspects of our lives. So if we're having a lot of mental health, stress or actual undiagnosed depression or anxiety, there's a physical impact. There's a suicide risk associated up with that. And I think that's really important, that we're really target those stigmas, and telling even not just older men, but our younger men as well, that it is okay to open up and talk to your close colleagues about this, your close male friends.
and so the benefit then is catching these things early. And how then does Syracuse Community Health help with that?
So, and this is actually perfect, because I do work in our CAPS department, which stands for Counseling, Addiction, and Psychological Services. And one of the earliest things that we do to try and see if there's any presence of, possible a mental health component of things is through our PHQ-9 screenings and our anxiety screenings, which are just brief questionnaires that we have you answer before I would enter the room, to see if there is, possible underlying depression or anxiety, that may need to be addressed, whether that's through just simply talking about it and, acknowledging that, what are these kinds of feelings that you're having? What are these thoughts that you're having? Is there anything that we can do immediately? Do we want to think about talking with a therapist? What are some things that we can do early, to kind of tackle this before it gets any worse, rather than leave it unchecked and allowed to develop into something much worse.
Are there any other types of things going on for the remainder of the month uh, for men's health awareness?
Through Syracuse Community Health?
Yes.
I'm actually not entirely sure, but I would love to see, in the future, that there are, some events, even if it's just setting up a table outside of the community health center to have,
Mm-hmm.
some individuals talk to the community members that are just passing by, and just handing out information about the importance of mental health, and why it can have it can impact so many different aspects of your life, and why it's important to, if you're struggling with something, to reach out to someone to talk with them about this particular problem, whether that's a physician, a psychiatrist, a therapist, your friend, your spouse, anyone. I think getting the awareness out there that there's a community that is here to support you is going to be a really great first step, and I would like to see that in the future.
And what do I say to my partner if they haven't been to the doctor in a long time, or my buddy, or whomever it is in my life, that I know that they're not taking care of themselves?
I think the a great way to kind of help, allow them to, I think the most important thing is to allow them to make the decision for themselves that
True.
they want to
Right.
go.
Yeah. Right.
But I would voice my concerns from, a friend to friend aspect, that, hey, I noticed that, this is kind of what's going on with you. You don't seem that, maybe you're not taking care of yourself in the best way possible. And, I just want to make sure that you get checked out, to make sure that everything is okay with you, because I don't want something to happen to you that could have been prevented, and I think just putting that little seed in their head that, hey, maybe I should go get checked out. My buddies are kind of worried about me, they see that this is going on with me. Maybe I should go get that checked out. And I would also try, if you can, if you have someone in particular that you trust, recommend that individual to them.
Mm-hmm.
I see this provider, he's great. He sits there, he listens, he, takes the time out. And I think that if there is a mistrust, right? Because there are always individuals who may have
Right.
had a mistrust in the medical system, especially people of color,
Yes.
that, they have providers that are there that are, willing to sit there and just listen to them, hear what they have to say, share their experiences without them being scared of being biased or their complaints are being dismissed, which would then discourage them from returning. Um, a lot of the times, individuals like myself, and a lot of newer providers, as we continue to become trained and as the training evolves, there is, cultural competency always being integrated into our courses all the time. Even now, as a provider now, I still get prompted for cultural competency training, which I think is a really, really big important thing, is to understand not just the conditions that can affect a particular group, but then the culture that comes with that. And, whether that's something from as simple as to how you address an individual to how you speak to another individual, I think is really important in making people feel comfortable so that they can actually open up to you about what's going on with their lives.
No, couldn't have said it better, because I'm not a physician's assistant and not trained to do all that. So I'm glad you were able to break that down for us, and that shows us why uh, centers and health uh, places like the Syracuse Community Health are so important. Health centers like the Syracuse Community Health are so important in our community. So if people want to make an appointment, they can call the center. What's the number, Noel?
Oh boy.
I got you. 315-476-7921. 315-476-7921. And lastly, what keeps you inspired to do this work every day?
I think what keeps inspiring me to do the work every day is to just hear the feedback from the patients every day, about, the work that I'm doing, whether it's from simple as, I really appreciate you taking the time out to really speak to me and hear out what I have to say, rather than just kind of taking a quick 5 minutes to, okay, we're going to do this, this, and this, and get you out the door. I think that's one of the biggest things that keeps me going and knows that I'm doing the right thing, is hearing the positive feedback from the patients that I, come into contact with, and the results that they're seeing from the advice that I had given them, and that they're really happy, with the healthcare that they're receiving. And that's what really keeps me going, is knowing that I'm putting out, a good medical service for these patients. And that's what really, really keeps me going every day.
All right, SyracuseCommunityHealth.org, 315-476-7921. They have two locations. Main office now is 930 South Salina Street. Their walk-in access services. What's that called when you just walk in? I forgot what it's called.
Quick care.
Thank you. 819 South Salina Street, just across the street, right under the bridge. You can access both those locations. They're brand new location with state-of-the-art facilities, and the Syracuse Community Health is a partner with Inspiration for the Nation. Thank you so much, Noel Castro, physician's assistant. And we appreciate the time you spent with us, and we appreciate the work that you're doing in the community to make our community healthier and safer. And if there's one last word you want to tell the men who are watching or listening, that would be what?
Please do not be afraid to come to us. We are here for you. We are here to serve you guys. We wouldn't be here if it wasn't for you guys. So we need you, the community members, to come to us, and we are more than happy to help you with whatever challenges you may face every day.
Noel Castro, physician's assistant, Syracuse Community Health. Once again, the phone number, 315-476-7921, here on Inspiration for the Nation.